So, good morning, good evening, good afternoon, everyone. We welcome you all once again on this experts interview by Elderly Care India and 50 Plus Assist. I am Dr. Mrigna Nagraj, founder of 50 Plus Assist. We are really delighted to bring you insightful conversation in aged care in Kenya today, a topic that is gaining increasingly importance, especially across Africa and globally. Joining me is my co-host, Dr. Pankaj Malhotra. And Pankaj ji is the founder for Elderly Care India, an organization that is deeply committed for the cause of aging in India. So, baton on to you, Pankaj ji.
Thank you, Dr. Mrigna. And today we are honored to have a very special guest on our show, all the way from Kenya. Uh, James, who's a leading voice in Kenya when it comes to elderly care and dementia care. He has been a strong advocate on the need for sound policies, guidelines, standards, as well as the overall delivery of aged care in Kenya and the surrounding areas. So, welcome, James. It is our pleasure to host you on this show.
Thank you, Dr. Ligna, Elderly Care and 50 Plus Assist Community. It is an honor to join you today. James Mbatia Kinuthia, President of Sir James Care Homes and Chairperson of Sir James Foundation. Any other nation is aging. With the growing older population globally, we cannot be counted out.
Thank you so much, Dr. James. And as far as our knowledge goes, you are a clinical medicine and a community health doctor, a master's in practitioner in dementia care, and certified professional in geriatrics and gerontology. So, with all the experience that you are, you are a part of, and the part of the foundation you are. So, my first question to you would be something that we are very curious about knowing is how elderly care ecosystem or how does elderly care currently function in Kenya?
Kenya's elderly care is developing at the moment. It's a very green area, but there are two major areas in its development. That we have the community level. As we are aware, most of our cultural values are really tied to our communities, both in India and Kenya. So we have the traditionally family take care of older people at home. This reflects our cultures and value, respect, belonging, and intergenerational bonding. However, modern work patterns mean families are stretched, many caregivers are untrained, dementia is often misunderstood as normal aging. Our foundation, therefore, invests heavily in community education, caregiver support, and reducing stigma. There is also the home and residential care service. This is where the transformation is most visible. In the last few years, Kenya has seen the rise of assisted living care homes, dementia-specific care homes, professional training programs from different organizations. So Sir James Care Homes is among the pioneers with branches in Nairobi, Kiambu, and in Tharaka Nithi County. We apply the Spark of Life model of care, which is a best practice, which has followed the WHO protocols of developing a model of care and a social care program, which focuses on compassion, connection, and restoring the spark in a person living with dementia. It shifts care from medical process to a human experience. Over the last decade, or well over a decade now, I've been working in a care home, and only those ones who are really in dire need would come to care homes. As I've stipulated, the culture, the family are very loving, and they are still taking care of their own as much as possible. So despite that, there is the behavioral changes. Sometimes somebody doesn't have anybody to care for them. So we instill skills to family caregivers who are mostly unpaid. We also make sure that we call out for online workshops to help people come in as many as possible to sensitize them. Generalize one day workshop now and then, actually is monthly. So we have been able to venture in that and help the community get the skills of how to care for these people professionally.
No, I think it's a lot of insight uh, from coming from you, especially when I've been, well, at least we all have been seeing the pioneering work being done by Sir James Care Homes and the foundation as such. So, coming from the same background as an extension of the question, I would like to understand, like India is growing and India is also trying to develop its own standards, guidelines, and policies. How is Kenya placed when it comes to the government standards or any kind of a specific guidelines?
Well, Kenya is still in its stages of laying the systems down. Last Saturday, we launched our branch in another county, and it's the first time that the Ministry of Social Protection has acknowledged our work, and the minister had to open the home, despite there are no guidelines. When we started this organization, it was more of giving back to the community professionally and also filling the gap. So really, we didn't know that there were no guidelines or anything like that. But later we came to realize, good Lord, we don't have these things. And we are like a demonstration centers. I think the government will venture into maybe partnering with as pioneers to give insights on their registration process.
Okay, so so basically, the government is open or opening up now to the idea of elderly care, and that at the institution level they need to do something.
Yes, having the ministry coming out and accepting to open a care home, a social care program, it means that they have been pushed to do that, and they are now aware. And also our first care home being here for last 11 years and full throughout. I mean, able to sustain high level of staff. It shows that there is a need in the community, and thus the government has no choice rather than to buy into the things that are coming up.
I think this is very interesting. And I think it also resonates very deeply with what we see in many developing countries. And policy often takes big awareness. And I think, like you were just explaining, that now the government has become interested, they're supporting, and your next chapter has been really supported by the government. So I think that makes a lot of difference, I think, in a country as a whole. And I think conversations like this that we're all having is like really part of, the whole process of building up, I feel. So my second question to you would be, let's say, what is the prevalence of dementia generally in Kenya? You just told us that, it is taken as a part of general aging in Kenya. That means awareness around this is of course is something which is we are building on little by little, it seems like. But what is the prevalence of dementia in Kenya, and how does Sir James Care Home support individuals or families who are dealing with dementia?
Sir James Care Homes is very steadfast. From the word go, we have although it's a silent epidemic. It's not really something that you can, but the prevalence is very high. We get like 3 or 4 calls per day. We have capacity of 10 people to stay in. And imagine 4 or 5 calls per day, and really these are families who are really searching for help. The prevalence is very high, but it's very quiet. I mean, there is no, because most will not even come out. And once they go to the hospital setup, there is nothing much to be done. So they are left to go for either home care. So there is no proper data per se. But globally, you are aware that the prevalence is very high, even in in African countries. Sir James Care Homes focuses on dementia rescue program. You find by the time families call us, they have really struggled. Most of them would come on, they come in our care when they are in their last stage. Others, those families which are informed, like you find they come early stage for the dementia rehabilitation program and the Spark of Life model of care, which we have witnessed quite amazing, despite being non-African, but both model from the Western world. But according to our work, we were able to get this Spark of Life model of care, which fitted more in an African setup than any other model from the Western part. But anyway, Africa will come up with a model in future, and maybe it will fit more. So our rescue program, person-centered engagement. I keep on talking about Tom Kitwood, who discovered person-centered care. The modalities of environmental, social, health, looking at a person as a whole, is what Sir James is trying or making sure that people are aware that is not just looking or caring for a person, but looking into their spirit, chaplaincy, looking into their personal care, combing their hair or reminding them to comb, just simple things, but they really matter to their well-being. Like having healing gardens or dementia-friendly environment where they can sit and relax with their caregivers, listen to some music or read a book. That really has really been bought in our community. We also involve families in our trainings, encouraging them. Most of them are stigmatized, encouraging them to join the workshops, and also encouraging them to attend to our annual awareness events, which you do every September, every year. It actually is the only major event that we do yearly. So families have been very supportive. Most of them have been able to give testimonials, coming out and spilling the beans that they needed this kind of care. So Sir James Care Homes is also removing stigma. We have been able to launch or to put up the first Alzheimer's film called Sparking Memories in the recent past. I realized that most people are watching it on YouTube. It's a free film You can go just pop in and watch it. It augurs very well with our community because it has, the actors were professional actors from the local communities who act in our national TVs. So it came out very nicely, and it has been able to break or create about dementia and other forms of age-related abnormalities. We have been able to train more than, I would say, every month we train about 20. So per year, you have like 200 to 500 caregivers going through our hands through the Sir James Care Homes and support of Sir James Foundation, which was formed by our friends, those people who had their mothers or their grandmothers here. They have come up with the foundation. I'm just serving currently as the chairman to give insights and to guide them in the way that it's supposed to be. So the foundation is also helping in strengthening their people's hearts and feeling that it's not about Sir James Care Homes, but it's about community service.
Excellent. In fact, that is probably one thing which I wanted to I wanted to ask you was one is the setup, the brick and mortar setup. Then second is the training part or the manpower part. So I'm talking of the manpower or the people who are going, the caregivers and the staff which comes and works in the care homes. In India, we have a challenge when it comes to qualified and professional staff. So how is Kenya as such? I know Sir James Care Homes is through its foundation doing a lot of training, but in general, is it easy or difficult to find good staff who are willing to work in this field?
Yes, it's not easy to find because they are not actually there. So the geriatrics and our tertiary level institutions have not introduced yet the geriatrics and gerontology, which is quite a shame because there again you have to retrain the nurses that you employ. But good thing we have the Spark of Life model of care since 2020. So our qualified nurses are trained under the Spark of Life model of care. One of them is actually currently a Master Practitioner in the model. So the essence of doing this is to make sure that they are humanized, because most nursing or the training is lack what we call humanizing or the care product in it when it comes to elderly care, or it's very minimal. So instilling this skill of empathy, compassion, and genuine love, and also social care is a bit tedious. And you know, their training is very fast. They are taught how to run here and there and ICU, high dependence unit, and all that. But now in our setup, you have to be calm, you have to be patient, you have to listen to the elder. So they undergo that training, and then they also, like our supportive partners or caregivers, also we have a system where they work in casual basis. So once you join us, the more you work well, it's also a vetting process or scaling up process for each worker. The more days you are given to work. So that system has also helped in making sure that there is rest supervision and giving people who have heart-led initiative in themselves to work for elderly people have a chance to come into our world.
Very true. Very true. I agree. That's a very nice way of putting it, and also I think great vision of going step by step. So coming to the African countries as such, which all other countries, in your knowledge, are working on the elderly care space, like the bigger countries like Nigeria and other places? So, how do you see Kenya in comparison to the other countries of Africa?
Other countries are coming up, but mostly you find what I would likely say is bottomless support towards elder care. So most of them have been left in advocacy. Most organizations have been left in the NGO level. So although investing in care is not something easy, but it's also very expensive to start a care home. So I think we are quite lucky to have Sir James Care Homes that is thriving at the moment and able to sustain itself. And I've been requested by so many people how we can replicate this model to other places. We get clients or we get residents, individuals all the way from Uganda. Even in the Western region, we are serving them here. So, I mean, Africa has no choice. The care economy is a huge investment bargain. It's not like most people would think it's a free service, and thus it should be done by missions. But it's a service that can create jobs. It's a service that will give opportunities for growth through even socioeconomic activities. I've seen it happen here when they do crafting and beads and crocheting, and you find someone saying, "Oh, I need a chocolate," and they send the caregiver a chocolate. They don't have to ask for money from their family. So it's a huge investment rather than a consuming investment as perceived, which is a African oriented notion that it is a waste of resources.
That's very interesting, James, to understand what are the thought processes of people around it. So I was very curious while you were talking about the Spark of Life program that you have, under which you train the trainers, you train the nurses, the caregivers, and everything. Would you please share a little more about this program?
Spark of Life model of care was founded by Jane Verity and Hilary. They are the founders of Dementia Care International, and they are based in Australia. And it's now since 30 years now, or even more, that they have been working. So it's a program backed by science and research. That's why it's a best practice according to WHO guide. So Spark of Life is a renowned model. And when I met Hilary and Jane in London, where I attended the Healthy Aging conference at the Commonwealth, I was thrilled because we have so many models that, but this one was backed by research and science. And I thought having the added advantage of having a medical background, yeah, I needed to humanize myself also first and try it out or pilot the model here in Kenya. And gladly they gave me the opportunity to do it. And everyone is like it's a good model. I mean, families, I can tell you the amazing recoveries at our rehabilitation program. Somebody who was not talking. So people are less dependent than before. I used to struggle a lot because I had only my medical mind and my heart, which maybe needed more food into it. And I can tell you it's amazing. So the model itself is guided by principles of genuine love, compassion, and empathy, which are not commonly taught in schools because maybe people had not realized that the growing population is aging, and also coming with health aging programs from the UN, decade of aging. We had no choice rather than to get this model going.
So, James, last question from my end is how affordable or expensive is care in Kenya? Is it affordable by most of them, or it's only the elite who can afford it? So, you can just give us a little insights on this particular part.
Yes, we have managed to have, as I say, it's my initiative, and I'm not commercialized, and I had no intentions of commercializing it. So what we have done is having technical or scaling the care model to community level. The home is set up in my village where I was born. So my work was to bring this service to the people, and also the people should help in maintaining and sustaining it and owning the program. We will find, I wouldn't call it, because most people have no plans on retirement benefits or such things like dementia coming or abnormal aging, or even having longevity in their life. Like you find people, if they get care, that they tend to live longer. So most families never plan for it. I'm taking care of middle class, elite, and I'm praying that we have more homes in the upmarket or where in the suburbs, where now the wealthy and the rich maybe could feel more comfortable there. Then my initiative looking into the middle class and the needy will continue with its strategic plan. Currently, I know mostly, or maybe in future, people commercialize it, but it's where you set up the home.
Very
that
true.
You can only do that. But where we are, it has to be negotiated. It has to be considered as an initiative and a rescue, but rather not a money-making program.
Oh, that's very interesting, James. So, from my side, the last question to you is what inspired you to start Sir James Home, or what was your inspiration, or what did you felt when you wanted to start this, please?
Number one, as a professional, in my university level, I did a research on nosocomial infections or hospital-acquired infections, and it was quite clear that you'd find most people staying longer in the hospital unnecessarily. You find top floors, elderly people stay there and they think it's home because they have no choice. So the research was more of like it enlightened me on what is happening in our communities, because even here you could go and find elders, especially during Christmas period, they will be taken to hospitals. Families have money they can pay for 1 week or two. So why not admit her? So it was not a good thing to the elderly, but with the it was not a good thing for the elderly, health-wise, socially, and all that. Because they need a place they call home, a place where they don't see as if they are in an institution. So that research was one of my guide on how I can help my community as a professional, and also intuitively. Most people tell me is a calling, but it has taken longer to see anybody being called. It's now 11 years. I'm asking who else is being called because
That's interesting.
because some of these things must be done by professionals. It's not about you must fill up the gaps like any other things. Like these days we are using solars and all green energy. We are talking about that. So it's about commitment and backing your initiative with the tools, because otherwise it will never be done. I mean, our elders will be left neglected all the time as we wait for somebody else to be called.
Okay, I have a kind of inquisitive question. Do you have a word called dementia in your local language? Is there a word for dementia in local language? Because India, we are still
Yeah,
struggling,
not
I
really,
guess,
no.
with the Hindi word.
Not really. They say that you have become a fool.
Very similar to the Indian mindset. we didn't have a word, so we used to have something else that the person has gone senile, which in Hindi is not very inviting word.
Yes.
But yes, I guess slowly these words will start entering our dictionaries, and terms like gerontology, Alzheimer's, dementia, and I think that is where the larger public will understand, because it has to be in their language for people to a simple word will which can relate to this particular field. I think that will bring in more awareness. So I think it was a great insight, Dr. James, and I'm really happy that we finally got to hear your insights and got to learn about the Kenyan care care sector. So thank you for coming for this session, and we look forward for many more sessions and more insights from your side. Mrigna, from you.
Yeah, thank you so much, Dr. James, for coming. And I feel across our cultures, we've been taught that the elderly speak and the generations are supposed to listen. And when the elderly is cared for, the whole community feels healed. And this is very interestingly when I heard your approach of empathy and compassion being the core values of working. So I feel that really roots for the Indian African culture and speaks for it by itself. So thank you so much for that. And thank you for helping us also understand this perspective where it's not neglect, but sometimes it's just lack of patience and lack of training that people have. So let's walk together, ahead with this knowledge that we have discussed today. And I hope in the coming time when we'll reconnect, we'll have some very new projects and new things to talk about. Thank you so much for coming here. Thanks a lot.
Thank you so much. And it was lovely to have you all. And we'll keep doing the work out here and improve our aging population's welfare and their care. And we are all here as professionals to help. As they say, it's a calling. Yes, we have to do it. but it's a sacred thing. It's a sacred opportunity, and it has hit us that it's about time we come together, support each other, give insights, and make the work, which sometimes it might look like a burden, make it look like a sacred thing that you're doing. Thank you very much.
Thank you very much, and
Thank you.
wish you all the best for this initiative. And really, thank you again. Thank you.
Thanks a lot.
All
Thank
right.
you.
Thank
Bye-bye.
you so much.